Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about how long do you have to do physical therapy after knee replacement surgery. Before I jump into that, please be sure to hit the subscribe button and turn on the notifications so you can catch all of our latest videos. So first, I'm going to say just kind of what the general average the answer is to this question, and then I'll go into a little bit more details because everyone is going to vary significantly from one person to the other. So on average, if you're progressing appropriately, if you don't have any complications, if you have good carryover, you're doing your home exercises, you're following the advice of your surgeon and your physical therapist, if you're have your pain well managed, then on average, I look at around 4 weeks on the shorter end of outpatient physical therapy to about 6 to 8 weeks on the longer end of physical therapy after a knee replacement surgery. Now, again, this is a very rough average. There's going to be people who may not do any physical therapy after surgery. It really depends on a lot of different things. So if you're someone who has really high self-efficacy, really good carryover, you're able to do your home exercises, you're familiar with exercising, you're going into surgery with a decent amount of strength and mobility already, you're not new to exercise, you're able to self-motivate yourself, you're going to need a lot less physical therapy on average. Then there's folks who, you may not be familiar. You may be kind of a beginner when it comes to exercise. You may have a lot of pain, a lot of stiffness, a lot of maybe some other complications that are going to prolong your rehab and recovery. Maybe you're someone who just needs that extra coaching, that extra motivation and supervision as you go through your exercise program. So you're someone who's going to need more weeks of physical therapy. Maybe you're up in that 12 weeks. There's even folks who will go quite longer. Again, there's a lot of variability, but on average, I would say the answer is anywhere from 4 to 8 weeks for an average person, can be up to 3 months or more if you need that extra assistance. Some folks, it may be hardly any. A big thing to keep in mind though, so with all that in mind, is you definitely want to think about specific goals rather than timeline. So when I look to discharge someone from therapy after surgery, I'm not necessarily looking at how long they've been on therapy. I'm looking at specific goals that we want to accomplish. That includes pain management. You're able to manage your pain effectively at home. You're not necessarily going to have no pain, and most folks won't have no pain when they're discharged, but you have the strategies and the ability to manage it effectively. We're looking at your range of motion, getting your range of motion to whatever our target or our goal is, and this may be different for each person depending on a lot of factors. What your range of motion was before surgery, what are the activities and things you want to do after surgery. So we're looking at that, your range of motion. We're looking at your strength. Again, you're still going to have some weakness most likely when you're discharged from therapy, but are you continuing to improve that strength? And are you showing good mobility that, like, you can go up and down stairs, you can get up and down from a chair easily, you can do your home exercise program effectively, you may be referred to or continue your exercises at a gym, you may go to the pool, you may do some type of your own exercise routine, maybe you'll choose to stay active just through your own activities, walking, gardening, hiking, cycling, whatever that may be. And all those are really effective. I always tell people the most effective physical activity and exercise to do is the one that you're going to do consistently and continue with for a long, long time, well, essentially forever after your knee replacement surgery. So those are the things we look at a lot more, getting you back to doing the activities, doing the things that you want to do, making sure you're functional, making sure you have good mobility. Those things are a lot more important to us as therapists than, it's been 4 weeks since surgery, it's been 12 weeks since surgery. We keep that in the back of our mind just as a general guideline, but really we're looking more at those specific goals, that we're trying to accomplish before effectively and safely discharging you from physical therapy. So I hope this video helped answer that question. Please be sure to hit that like button if it did. If you found this helpful, leave your questions, your comments below, as I always get back to whoever I see. And thank you very much for watching.